Actually, all right, why don't we go ahead and get started? For everyone here, if you could do me a favor and go to the bottom of your screen, and there'll be a globe, and on the globe, there's multiple languages. I'm gonna have folks click on the, if you already know which language you're going to, and you're welcome to go to that room directly. We're also going to explain in the different languages how to find them. But everyone else, please do me a favor and click on the English room. And if anyone has questions, feel free to ask, or either in chat or in or out loud. And then can I have, let's start with the Spanish interpreter who's going to announce how to find the Spanish room in Spanish. Oh, and please remind folks to keep their cameras off.
Buenas tardes, por favor, si nos quieren encontrar en español, opriman el globo que está al pie de la pantalla, escojan la palabra Spanish y así me podrán escuchar a mí en el canal de español, y también mantengan las cámaras apagadas para poder permitir a las personas que están escuchando a los intérpretes sordomudos a encontrar los intérpretes. Gracias.
Gracias. And then can we have the French interpreter, please?
Bonjour à tous, merci d'être venus. On est très content de se rencontrer avec vous encore une fois aujourd'hui. On voudrait juste vous rappeler qu'on donne accès à des langues différentes, et si vous regardez en bas de votre écran, vous allez voir un petit globe où si vous cliquez dessus, vous allez pouvoir choisir des langues différentes, et vous pouvez choisir le français pour que vous puissiez suivre que vous puissiez suivre en même temps que l'interprète de français interprète. Merci.
Merci. And then the Somali interpreter, please.
Yes. Assalamu alaikum. soo dhawaada galab wanaagsan fadlan qaabta ugu hooseysa ee telefoonka ama shaashada aad isticmaalaysaan markaa gujisan waxaad arki doontaan liiska luuqadaha. fadlan haddii aad u baahantiin turjumaan af Soomaaliya, luuqadda Soomaaliga doorta. sidoo kale qofkii aan ku dhageysanayn turjumaad, fadlan ha doorta maaragtay English si uu u maqlo markii la turjumayo luuqadaha kale. waa mahadsantihiin.
Thank you so much, Ismail. Did anybody have any questions about that? Okay, we're going to go ahead and get started. I think I know most of the folks in the room, but get to hear my usual spiel anyway. Hi, my name is Becky Reitzes. I work for Public Health Seattle and King County. I've been here 21 years, which is wild. And I've been working on the COVID response since March of 2020, and now currently on the monkeypox response as well, and other health inequity and health equity initiatives. The reason that I mentioned that I've been working on the COVID response since March of 2020 is, trust me, not to brag, it's just to put out there that there's been a lot of changes that we all know since the beginning of the pandemic. And I think that sometimes those changes can really lead to a lot of, or sometimes lead to distrust of our messaging, or distrust of prevention measures. And so if anybody has questions that are off topic of what we're talking about today, about like, why did we go from mask to no mask to mask to double mask to no mask, or things like that, please feel free to ask, whether it's for you or trying to figure out how to explain those those events and those changes to other friends, family, or community members. I think it is really important for folks to understand a lot of the changes and updates, and that way we can help build our trustworthiness of the messaging that we're sharing, that we're all sharing. So yeah, so I do want to say that we are recording. I apologize for not sending out the recording last week or from 2 weeks ago. I've just been slammed, and so we'll get that out to you soon. But I did send out the email, and if anybody needs any other resources, please let me know. I think that's it. Okay, so, oh, and I really want to thank, usually Justin is helping me with this meeting because it's a collaboration between my program and the community-based organization task force. And Justin has been out and Gina has been helping me tremendously. So I really just want to thank Gina. And that's all. But because we are recording, I know sometimes people don't feel comfortable asking out loud. So you're welcome to put them in the chat. I might miss it. So Gina is going to be monitoring the chat. If you would like to send a private message, you could send one to Gina. And Gina has got her thumb up right now, Gina Hernandez Rodriguez. You can send her a private message, and then she can interrupt me anytime and ask the question anonymously. Really, there are no dumb questions. I know we often say that and don't mean it, but COVID it's all new, and monkeypox, we haven't seen it for 20 years, so really no dumb questions, but feel free to instant message her if you would like. If you don't know how to do that, you can unmute and ask me or put it in the chat, and I can tell everyone how to do that. Okay, sorry, I've been rushing today. I can take a breath. All right, so we're going to do the usual King County case and vaccine rate updates. We're going to talk about flu season. There is a 3-day event happening in Seattle for free eye exams that's open to all. And so I really wanted to make sure that folks know about it, whether it's for yourselves or for your communities. I know a lot of folks here work for community organizations, so I really do try to bring information that's helpful for community organizations as well. And by the way, when we talk about flu, I will email this out, but there is a toolkit through Medicare around the flu season. So especially because as we're going to talk about, the flu can be particularly dangerous for folks who are over 65. And then we're going to do a monkeypox update. I did not bring sort of the more general information about monkeypox, so I'm happy to answer any questions. I know sometimes folks miss meetings, and so happy to, or just there's a lot of information. So happy to answer questions. And then we don't usually go through the resources, but there's a ton of resources at the end of the presentation that I send out in the PowerPoint in the email. All right, so let's get started. And again, feel free to interrupt me anytime. I like dialogue. Oh, and I should say, you know, just a reminder, the reason we have people keep their cameras off is not because I don't like to see your faces, but it's out of respect so folks can find the interpreters as they're spotlighted. So it's easier to find them when the cameras are off. All right, so let's do a little King County update and where we are around COVID. And again, this is our new dashboard and the new symbols. So I'm just going to keep this in here. All right, so again, our rates of COVID are still in the low range, which is great. The low range means there's limited impact on our healthcare system, low levels of severe illness. Just a reminder, we don't really have good counts of how many cases we have anymore, based on the fact that many folks are doing home tests, and really people weren't reporting the home test to begin with, and so DOH put out an announcement that folks did not need to continue to report the home test. So we don't really have a great count on how many cases there are. We only have a good count on how many cases are reported. So what we're seeing on are 79 cases reported in the past 7 days of COVID. But again, take it with a grain of salt. One, because the home test, but also what we know is our data, there is a systems issue currently with the data. So this first part of the data I'm going to be giving you is going to be, we know that it's not complete because of that systems issue through DOH and Department of Health, sorry. And Department of Health is working to resolve it, but that's where we're currently at. What we do know or believe is that the COVID case rate is stable and possibly decreasing slightly in the past week. The case rate is similar across nearly all age groups in the county, and the folks who are having the highest reported case rate are folks who are over 65. Questions about that at all? And just a reminder that we are considered low levels of the Center for Disease Control table, but we're considered low when our case counts are fewer than 200 cases of COVID for every 100,000 residents over the last 7 days. And again, these counts for the past 10 days are also severely undercounted, again, due to the same systems issue. I brought with me what's on our website, but we know that these rates are not, or these numbers are not complete. And again, Department of Health is working to resolve it. But again, based on our best estimations and what we know right now, in terms of hospitalizations for COVID-19, there is about 2.2 out of 100,000, and again, severely undercounted. And 4.5% of inpatient beds in hospitals are occupied by COVID-19 patients. So my recommendation, again, I always send out the live links. So my recommendation would be to continue to go back to that website if you want to know what the correct numbers are, because as soon as they get corrected, we will put them on our website. Sorry, my voice is not doing so great today, apparently. Unfortunately, the majority of admissions are among our community members who are older than 65. And I say unfortunately because we know that in the beginning of the pandemic, folks who are most likely to be hospitalized, but also most likely to die from COVID, were folks who are over 65. So definitely folks can have complications from COVID when they have underlying health conditions, and people over 65 are likely to have some underlying health conditions. The emergency department visits and admissions for COVID-like illnesses are decreasing over the past 2 weeks, and the hospital beds occupied have been stable in the past week. But again, a reminder, I've already said it 3 times, that we know these numbers are undercounted. Questions at all for me? All right, and then in terms of deaths from COVID in the last 2 weeks, death trends have been stable in the last 14 days. And again, the majority of deaths have been in folks who are older than adults 75 and older. And an average of 2 new deaths due to COVID illnesses reported daily over the last 7 days. Just a reminder, I often read my slides, not to be condescending, but to make sure that I know the interpreters are only going to interpret what I say. And so to make sure that everybody gets the same information. So before we move into the vaccine rates, are there any questions for me? One thing I do want to point out is the first folks who were able to get vaccinated in Washington, in King County, were people who were 65 and older. And so the fact that we're seeing folks who are 65 and older hospitalized and dying makes me question whether or not this is due to folks being due for their boosters and the vaccines like losing their effectiveness and not working as well. So what we know is it's really important for people to continue to stay up to date on their boosters so that they can continue to be protected against COVID-19. So let's look at the vaccine rates. And this is what I was just saying. So these are, you've heard me say this 1,000 times, but the biggest talking points, I think, for the vaccines is that, yes, we know that people are going to get COVID even when they're vaccinated and even when they're up to date with their vaccines. And especially with these new, much more contagious variants and subvariants. But we also know that when folks do get COVID and they're up to date with their vaccine, they're usually going to get a much more mild case of COVID. And what the vaccines are really good at, so Pfizer, Moderna, and Novavax are really good at, is preventing people from getting seriously sick from COVID, being hospitalized from COVID, dying from COVID, and getting long COVID. So super important to stay up to date with the vaccines for people who choose to get vaccinated. We also know that the vaccines and boosters make it less likely for people who get COVID-19 to spread it. And that's because they're going to have less virus in their body, because the vaccine is going to help keep that viral load, or the amount of virus in their body, down and keep it lower. So they're going to be less likely to spread it. So when you have friends and family saying that they're not going to get the boosters, or not going to get the vaccines, and the reason for that is because, you know, oh, well, people are getting COVID anyway. These are like the big talking points is, yes, people are going to get COVID. No vaccines are 100%, and the new strains are definitely more contagious, but the vaccines are effective. But this is what we mean by that, is they are best at preventing serious illness, hospitalization, death, and getting long COVID. So I have a question in the chat. We know that seniors are the most likely to have already gotten the new bivalent booster, but even for them, only a small percentage of people have done so. Yeah, so that is a really great segue, Karen, into my next slide, which is that we are still, even though a lot of folks were waiting for this new booster, which again, I can explain this new bivalent booster if anybody missed last week or wants me to talk about it. But in terms of folks who are eligible to get it, which are who are folks that are 5 and older, only 45% of folks have gotten who are eligible. So 5 and older and 2 months from their last shot are eligible. Sorry, only 45% of those folks have gotten this new booster. That number is even lower for folks who have had been updated with boosters in general. So even though we have a really high rate of people who completed the series, if they completed their series a year ago, they are that vaccine has probably what we call waned or is less effective now. Or 6 months ago, that vaccine is going to be less effective. So super, super critical that folks do get the boosters to keep themselves protected against death, hospitalization, and dying. And then what Karen was saying, and especially seniors or elders who are going to be much more likely to be hospitalized or die from COVID. And then I do want to say that currently folks who are able to get the new boosters, so this is the people who are up to date, sorry, I may have said that wrong, but folks who are up to date with their vaccinations and boosters are 45%. And folks who are able to get the new bivalent booster are folks who are 12 and older. What we also know is that we'll soon be changing. We don't have a date yet, but we know that soon the next lower age range, 5 to 11, will be available for this new bivalent booster as well. So don't ask me a date, I don't know yet, but I know we've been told it will be happening soon. So high rates of people who completed their series, but let's say they got Johnson & Johnson. They completed their series. We know Johnson & Johnson is not effective against these new strains. So even though they completed their series, they are probably not very well protected against the variants that are currently out there. So very low rates of people being up to date with their vaccines, meaning they're getting the boosters on schedule when they need it. And that hasn't been changing very rapidly. We have seen since this new bivalent booster has come out, or some people call it the Omicron booster, we have seen a larger uptake in that one, but still really low rates of people being up to date on their vaccine. And the way that I like to think about it is, if you are somebody who is going into a grocery store, and most folks, if you've noticed, are not wearing masks anymore, and you're not wearing a mask, and you walk into a grocery store, probably, again, thinking about only 43% of folks are up to date with their vaccine, probably 47%, did I do that number right? No, 57% of the folks in the room are not very well protected against COVID, which means they might be more likely to have COVID. All right, questions on any of that? All right, and then in terms of overall coverage, the interesting thing was from 2 weeks ago today, the only thing that has changed in this whole slide is the fourth bullet down. And that is because of the new booster. So 91% of King County has received at least one dose. Unfortunately, one dose is not an effective vaccination. So the first thing people need to do is get the first dose if they choose to get vaccinated. And then the second thing they need to do is get the second dose, because that one dose is really, really suboptimal, meaning it's not going to protect somebody well. So 83% have completed their primary series, and now what we recommend are going to be Novavax, Pfizer, and Moderna, all of which are 2-dose series. Only 52% have received at least one booster. 9.6% have received an updated booster, so that's almost doubled from last time we all met together. And most of that is attributed to this new bivalent booster. Just a reminder, this new booster has both the original booster in it and then also the updated mRNA molecule that will help prevent people from getting Omicron, and specifically BA4 and BA5, which is BA5 is the most predominant strain right now, or subvariant right now, and also can bypass previous immunity from COVID, and also from previous vaccinations. And so this new vaccine will actually prevent that from happening, which is great, and also protect us from the other strains as well. And then only 43% of residents are currently up to date on their vaccines. So that is a very, very low number. Questions? All right, and in the last week, we've had 61,000 cases, 61.2 thousand cases administered to county residents. Sorry, not cases, doses. 61.2 thousand doses of the vaccine were administered. And then virtually the same, which is pretty much the same number that was actually even a little lower than the previous week. However, people getting the new boosters remains high. What we know is that, as Karen mentioned, the folks who are the highest, oh, we're going to do this next, actually, but the highest group is folks who are over 65. We know most people are getting vaccinated at pharmacies. 23% are getting vaccinated at hospitals, and then a little over 8% are getting vaccinated by others. So other providers, many of which are in their pediatric offices. So for a lot of folks, they feel more comfortable taking children to their pediatricians or their regular doctor's offices. So all of these places are administering the vaccine. And then a reminder that public health, we're still doing community vaccinations. And I have a slide coming up that we still have our vaccinations happening at the Auburn Mall and the Bellevue Clinic, which is the East Bay Public Health Clinic. And then 218,000 people have received the updated booster, which is about 9.6% of the total population, and 14.3% of the eligible population. So there is a gap there. And then South King County remains continues to have lower coverage of the boosters and being up to date with vaccines than other parts of the county. And by age, we see again the highest group, about 29%, getting the vaccine are people who are older than 65, which again is great because people older than 65 are more likely to be hospitalized or die from COVID. We see about half of that number in people from 35 to 64. And then only about 8% from 12 years old to 34-year-olds. So it's still, even though we see more people getting the boosters, it's still a pretty slow uptake in getting it. All right, any questions for me?
No questions so far.
Thank you. All right, so one of the ways that we're able to measure how effective the vaccines are and make the statements that we make are we look at the rates of people who are not fully vaccinated compared to the rates of people who are boosted and up to date with their vaccines. And so this does change depending on how many people are boosted and up to date. So currently, the folks who are not fully vaccinated are 1.8 times more likely to test positive for COVID. Sorry for cutting out that C. People who are up to date are 5 times more likely to be hospitalized and 9 times more likely to die from COVID. So this does give us a really good picture of the fact that yes, the vaccines are effective and mostly effective against hospitalization, death, and long COVID. And I liked this sign from the World Health Organization that, especially when I walk around in the world and watching some things, observing people's behaviors, it's just a good reminder to know that we're still living with COVID-19. It's not over. Last week we talked about, I think it was 2 weeks ago, we talked about, if we're in a endemic or a pandemic, and it's just really helpful to remember that it's not over. The less people stay up to date with their vaccines, the more that we are going to see more variants, and we're going to see more people getting sick with COVID. So a reminder that about 40% of people who get COVID do not show symptoms at all. That the COVID-19, well, we talked about this, vaccines greatly reduce your risk of getting seriously ill and dying. And that we really stress that if folks are going to be vaccinated, it's super important to get this new vaccine if you are eligible, and to stay up to date with the vaccines. And a reminder that, we all know that there are other ways to also stay healthy. Wearing a mask is great for you. It's better for the person sitting next to you because, we still have eyes where the virus can get in. But if someone next to you is wearing a mask and they're coughing, it's going to stay within their mask. We want to make sure to have really good ventilation, wash our hands, not touch our faces without washing our hands, safe distance, all the stuff we've been talking about for 2 years. All right, any questions from me? All right, and then we do have 2 new flyers available, so I'm gonna send this out and they'll be on our website soon. I looked for them, they weren't up yet, but I'll send out the PDFs of them. And we have them currently in English and Spanish, and I'm assuming we'll have them in other languages as well, but they're flyers to help share information in the community about the new booster. So this is the first one. This is the one in English, and it's just, again, a reminder about what the booster is, that, how it works, that it is always free, regardless of insurance or citizenship status, and then where through public health you can get them. And I already mentioned that Auburn Outlet Mall, and then our Eastgate Clinic in Bellevue. And then, of course, we just talked about a lot of folks are going to pharmacies and to their own providers as well. And then again, we have the same flyer in Spanish. So again, I'll send these out as PDFs, and I will also send out, these are live links to be able to get the flyers. All right, we're about to move off of COVID and into flu season. Because here we are, flu season. Anybody have any questions though about the new boosters, about COVID in general, the strains, anything like that before we move on? I like to give a little awkward silence so people can unmute, they can type. All right. Well, so you may have noticed that we are getting a flu season again. We are getting, people are getting lots of viruses again now that we are no longer mandating masks. That first year where we were mandating masks, we actually had no flu season. It was really lovely. Unfortunately, we had COVID, which is much more deadly, but we did not have a flu season. Right now, I'm a little worried about my voice because my partner has been extremely sick for days, and it's not COVID. So I'm like, oh no. But here we are, back to flu season. So just wanted to give a reminder that it's really important and probably more important than ever to slow the spread of the flu, especially with the flu going around and COVID going around. Two of them together can be dangerous, and we're going to talk about that. People who are at the highest risk from the flu are people who are 65 and older. Sounds similar to COVID. People who have underlying health conditions also sound similar to COVID. So people with certain chronic medical conditions like asthma, diabetes, heart disease, folks who are pregnant, again, sound similar to COVID. And a little bit different than COVID is children younger than 5, and especially those younger than 2. So these are the folks who are going to be at the highest risk from the flu, of getting severely ill and hospitalized or dying from the flu. Just a reminder, a lot of times people are like, oh, COVID is just like the flu. So we have seen a much higher death rate and much higher hospitalization rates with COVID than we have the flu. So just putting that out there as a reminder. The flu shot is covered by most health insurances, including Medicare. So it's free. And these are, I put links to both the Medicare coverage information and then, which again, I mentioned, they just put out a new toolkit. And then also to our King County Health Center location. So if you do not have a healthcare provider, at all of our sites, we have folks who can help get you on insurance, including, for your low cost insurance, depending on your income and family size. And also, if you don't have a provider, we have providers at our sites as well. So just a reminder, the flu spreads easily from person to person in schools, workplaces, homes, and we are again having a flu season. And then everyone older, like 6 months of age and older, can get a flu vaccine to prevent, again, same thing as COVID, prevent serious illness, hospitalization, and death from the flu. And people can get them at pharmacies, their doctor's offices, hospitals, and then protection is going to last through the whole flu season, which usually is going to peak in January or February, but sometimes it's going to continue into the spring. Folks can get the flu shot at the same time as the COVID shot. I've definitely heard people, say both, like that, oh, I don't want to do that, I'd rather separate them, or oh, I will do it. And so, but people can get them at the same time. And we actually do provide them at the same time at the county, for folks who want that. People with egg allergy may also be eligible to receive the flu vaccine. So it's a good idea if you do have that egg allergy to talk to the healthcare provider or your pharmacist about which flu vaccine would be recommended for you. So again, just a reminder, flu vaccine, not COVID vaccine. COVID vaccine has no animal product at all. And then these symptoms might look very familiar. So here's the problem, is flu symptoms, COVID symptoms, really similar. So some people can feel some of these symptoms from the flu, and some may get all of them, but they can have a fever or like have chills, a cough, a sore throat, runny or stuffy nose, muscle or body aches, headaches, tiredness, and then some people may have vomiting and diarrhea, though this is more common in children than adults. All of that is also true for COVID. And it's important to note that not everyone with the flu will have a fever. Again, all true for flu and all true for COVID. So that's the tricky part, is not assuming that somebody has one or the other. It's super important to get tested. And then even, I know for me, and probably for lots of other folks, this whole like stuffy nose thing can cause you not to be able to taste or smell. And COVID, it's not due to a stuffy nose, it's due to COVID virus causes like an inhibitor or causes something to block temporarily you from smelling or tasting. So you don't have to have a stuffy nose, but sometimes people do lose their taste or smell with COVID. I'm sorry, with the flu as well, due to like the stuffy nose or turning into like sinus infection or something like that. And then the emergency warning signs for children. I'm not going to go through all of this because I'm going to send them out, but these are the times you want to contact a healthcare provider. Is if the fever goes above 104 degrees, if it lasts for 12 weeks or more, which is huge. If they are not able to keep water in, so they're dehydrated, and ways to know that is that they're not peeing, they have a dry mouth, if they're crying, they're not having tears, or there's some ways to know that. If they have seizures or bluish lips or face, these are some of the warning signs that there's complications from the flu and difficulty breathing, and some similar ones for adults: difficulty breathing, persistent pain or pressure in the chest, dizziness, confusion. This can be linked to the dehydration, seizures, not urinating or peeing, muscle pain, severe weakness, and then worsening of chronic medical conditions. So if anyone's experiencing any of these when they have the flu, they are definitely an emergency situation that they want to seek medical care right away. So then what is the difference between flu and COVID? But again, I've already mentioned COVID has been much more deadly and much more contagious. So I just want to put that out there in the beginning. But both the flu and COVID are contagious respiratory illnesses, but they're just caused by different viruses. COVID-19 spreads more easily than the flu, and it can cause much more severe illness, much higher death rates. It can take longer to show up, for the symptoms to show up, and may be contagious for longer than the flu. You can't tell the difference between the flu and COVID-19 by the symptoms alone, because the symptoms are often the same or very similar. Again, I mentioned that about 40% of people with COVID often have no symptoms. We also see that sometimes people with the flu have no symptoms, which I know is not a common thing that we think about, but that it's true that people can have no symptoms and have the flu. And then people who get the flu and COVID at the same time can have much more severe illness than people with one or the other. So this is where it becomes really concerning. And then also, we don't want to be spreading either. So it's important to find out if you have one or the other or both, and to get tested. Also important to isolate and stay home or wherever it is that you're living while having COVID or the flu, and making sure to get lots of fluids so we don't get the severe dehydration as well. So similarities is that they both COVID and the flu can pass from person to person. Well, before they have actually symptoms at all. And one of the differences that we're going to talk about is that the flu, this is similarities, but one of the differences is that the flu is contagious for a day before someone has symptoms, and COVID is actually 2 days before they show symptoms. So I know for me, my partner showed symptoms, and I was like, ugh. We isolated, but it was already 2 days in that they had been contagious. And with the flu, you're usually contagious a day before. And then other similarities, it's possible to give COVID and the flu to somebody else, even when you do not have any symptoms. And then the differences are that for the flu, someone is typically may experience symptoms from 1 to 4 days after infection, and then typically with COVID, 2 to 5 days after getting exposed. So they're contagious longer before they show symptoms, and it takes a little while more for them to show symptoms with COVID, which is extremely concerning. That's where we often see people getting COVID, is either the person never has symptoms or they're contagious before they show symptoms at all. And it can take them longer to show symptoms. I'm pausing to see if there's any questions. If a person has COVID, they can be contagious for longer, which I already mentioned. For the flu, potentially contagious for about 1 day before they show symptoms. I already mentioned this. For COVID, it's 2 days. We know that people can get the flu, can pass the flu to someone else when they have no symptoms. They're more likely to pass it when they do have symptoms. I'm going to skip a little bit of this. And then again, I've already mentioned that that children are going to be more likely to, children with weakened immune systems can be contagious for even longer. And then for COVID, on average, people can begin spreading the virus 2 to 3 days before their symptoms, which is really concerning. And again, many people never experience symptoms. And then people are usually considered contagious for about 8 days after the symptoms begin. But we do see it sometimes longer than that. All right, any questions? I remember the first year of COVID doing a ton of training about the difference in COVID and the flu and how you get it and how you don't get it. I feel like people, are pretty aware of that at this point. I did want to give a little bit of information around that, especially to share with our communities. Any questions about that at all? Difference between the flu, similarities between the flu and COVID, concerns about getting both? All right, and then I wanted to let folks know that the UW is actually hosting a Zoom community conversation this Friday at 12 o'clock to discuss updates on COVID-19 boosters and flu shots. It's just another place to get information. And the panel is going to be Dr. Green from their infectious disease department, Dr. Taylor from pediatrics, and Dr. Chopra from primary care. So, and you can actually submit your questions, which you can do here too. We got that chat going on. Checking it out. But you can submit your questions ahead of time and they'll answer them. And so I made sure this is, well, I have the flyer. Oh yeah, this is a flyer for it. I put it into 2 sections just so you can see the whole thing. But you can submit your questions beforehand. So I wanted to go ahead and put the link in there as well. So again, this is open to everybody in the community, not just UW folks, and it should be a really interesting chat. Ooh, awesome. Priscilla just put in the chat, and you'd like to register for the webinar, please email Priscilla. Thank you. That's awesome. Thank you. Priscilla, do people, I mean, here's the link about registering. This one is not live, so I can include that in the email that I sent out. Sorry about that.
This is a live, it will be a live webinar. I'll grab the registration link and pop it into the chat here.
Okay.
It's a live webinar, and then it will be recorded and put up on our YouTube channel afterwards.
Great. And but do people, sorry, the question I was going to ask was, do people need to register to attend and to get the link to the live webinar?
Yes, the registration is how you'll get the link. Yep.
Great. And then is that registration on this link that I have here?
It is, yep.
Okay, cool. So if you could put it in the chat too, that'd
Sure.
be great. Thank you
Thank
so
you
much.
so much.
Yeah, I literally got this flyer at 3:15 and we jumped into the call at 3:15 to make sure that all the technology is working. So I was creating this this portion last minute. So I'm really glad you're here, and I'm glad that I was able to get this information. Also, I'm going to put my email in the chat. I don't have a PDF of this flyer. Oh, it's this Friday. I don't know that I'll be able to get it out by then, but if you have a PDF of it, if you could send it to me, that would be great. And that way, if I can get it out in time, I will. But also just putting the link in for registering, and people can register right now if they choose to. Thank you, Priscilla. I appreciate it. All right, Priscilla, is there anything else you wanted to add about that before I moved on?
I will send 2 links, so one for the registration. The other one is a Microsoft Forms where you can submit your questions. The questions are compiled and sent to the panelists prior to the session. And then you can also use the Q&A function during the webinar itself if you'd like to admit or submit additional questions. And then we will be having one the following week, the 21st, with Dr. Jana Friedley, who is with our long COVID clinic. So I'll send that information to you as well.
Okay, and is that specific about long COVID, or is that the same topic?
Specific about long COVID. So this session on Friday will talk about COVID boosters and flu shots, and then the following week will be long COVID.
Awesome. Yeah, if you could put that in the chat, that'd be great.
Okay.
And
Thank you.
if you have a link to the flyer, because we won't have another community partner call before that. So if you have a link to like the flyer or the website, that'd be great.
Yes, it's in works right now. It's not quite finished, but I'll forward it. I bet you got this from Marielle. I sent it to her.
I did.
Wonderful. Yeah, I'll get it out to you. Thank you so much.
Yeah, thank you. Got it at 3:15. So here it is. All right. Any more questions about that for Priscilla or for me? Although Priscilla knows way more than I do about it. Okay, so again, it'd be great to let, oh, Priscilla, can I ask you one more thing? Will it be interpreted at all, or is it just in English?
It will just be in English. I actually am quite impressed and admire the interpretation situation that you have going on here. So unfortunately, it is not, it's only in English. There will be closed captions available. Yeah.
Okay, thank you. Our interpretation is always available upon request. So if people have requests for other languages, again, you can go ahead and request that, and we can get other languages available. So that was a good reminder. Thank you, Priscilla. All right. I also wanted to let people know that they're coming up. There's a 3-day event. This had been an annual event that stopped during the pandemic and is starting up again. And it's really exciting because there's definitely specific services that are really hard to get in King County without insurance. And glasses and eye exams are one of those. So there is going to be a 3-day event where people can get free glasses and free eye exams. And I'll show you the flyer that has all the information. And it's going to be in Seattle at the Seattle Center between October 20th and the 23rd. People will get they'll do the eye exams this day, and then they'll get the prescription eyeglasses in December. So this is led by Seattle Center and the Seattle Center Foundation, and then they're linking up with lots of healthcare organizations and nonprofits and private businesses and civic agencies. And we're super proud to be a part of this because, again, this is a hugely needed, this is a much needed service in King County. And again, it's not restricted to Seattle or King County. So if you work with folks or you are somebody from Tacoma who needs this, or Snohomish County, It is not restricted to residents of Seattle or King County, but it is happening down at the Seattle Center. Seattle Center in the Fisher Pavilion. The one thing to note is that tickets are limited, so it is a really successful event every year, and it's a first come, first served basis, which we all know is not always the fair way to do things, and this is often how things are done. So it opens at 6 a.m. So that people can start getting their tickets, and then the doors to the clinic will open at 7:30. And then once the clinic opens, patients are escorted to the service facility and admitted by ticket number to be registered and receive their free eye care. And then again, as I mentioned, if prescription glasses are ordered, they'll be distributed in December, early December, which really is right around the corner. Just shocking to me. So a few things to know before you go is that face masks are required. Though if somebody is sick, they're requesting that people do not attend if you are sick, and face masks are required. Identification or proof of citizenship or immigration status are not required. Again, this is free. Do not need ID, do not need proof of citizenship. Everybody is welcome. There will be free interpretation services there. That is available, and there's free parking at the Mercer Street parking garage at the Seattle Center. And then I'll send this out, but more information is available at seattlecenter.org/patients, and I'm going to put that in the chat as well. That I can't type today. So that is the link to this event, and also free parking at the Mercer Street parking garage. Is kind of a big deal. The place is wildly, I shouldn't say anything like that. It's expensive. So, and then the flyer is available to download in all the languages that are listed here, so many languages. And then just a reminder to not attend if you are sick. So we will get this out. I'm looking at the date. Yeah, it looks like we're gonna need to get this out as soon as possible. So I might send this PowerPoint out before we get the recording done, just so folks can have all the links, especially to share for folks who work in organizations, to share with your clients and customers, your families, your friends, anybody who needs free eye exam and glasses. And then there is a frequently asked question page. You can get to it really easy from that link that I put in there, but it's at the seattlecenter.org/SKC-clinic/FAQ. You will see there's a picture of like an ultrasound happening here and some other health things happening here. So to be clear, this year, all they're doing is eye exams and prescriptions. So I just want to make sure that that's clear, because in previous years, they've done other clinics as well at the same time. But this year it's just eye exams and free glasses. All right, any questions before we move to the monkeypox update? All right. Here you guys get sick of hearing me? Don't you want to ask some questions? All right, so update about monkeypox. Well, the biggest thing I want to say is we are seeing a really steep decline of monkeypox cases and decline in the direction that it was headed here in King County, which is great. It means that we maybe learned some wonderful things about how to handle when emergency virus arrives in King County. So it's really good news to see that the numbers are dramatically slowing down and reversing course. So that's great. As of the 7th, these are the most updated numbers we have in King County. There was 466 cases of monkeypox, 15 hospitalizations, and then throughout Washington State, 620 cases. That margin between the two, King County and Washington State, has gone up a little bit, but in general, those numbers are much lower than where they were headed. And still the overwhelming majority of cases in Washington State are in King County. In the US, the number of cases in the US of monkeypox is 26,778 cases. I said all this. Yep, so most of the decline of monkeypox is in King County, where most of the cases are. And then our health officer, Dr. Jushin, said that the decline in cases is likely to due to a combination of factors, including behavior change in folks who were at the highest risk of getting monkeypox, and the vaccination of, again, communities who were at highest risk of getting monkeypox. So we have made sure to get the vaccine out to folks and made available. This is the breakdown of cases. So again, still the majority of folks who have it are between, or who will get, who have it are between 18 and 49. About almost 95% of the folks who've gotten it are cisgender men. And cisgender men, the term means men who were assigned at birth as male and continue to identify as male. And then in terms of vaccination, the vaccine supplies are very limited in the beginning of the outbreak. And therefore the vaccine eligibility criteria prioritize only people who are at the very highest risk, and now we have more vaccine available. And just a reminder for those folks who are going to Canada, Canada is no longer allowing American citizens to get vaccinated there. So if you think that you are, bye Viviana, it's good to see you. If you think you're going to be able to go back and get your second shot there, the second shot is at 28 days. Just know, don't do it. You're going to waste a lot of gas, which is very expensive right now. And we do have more vaccine available to folks. And again, I can send this out, but there's a new eligibility list, so which has been expanded. So anybody can get the vaccine who has skin-to-skin or other close contact with someone with monkeypox, men or transgender folks who have sex with other men or other transgender folks, people of any gender or sexual orientation who have who engage in commercial or transactional sex. So that can be for money, it can be for shelter, it can be for food, it can be for any other goods or needs that they may have. And then again, we're not recommending vaccination for the general public or for people who are not at risk to being exposed. And I have this in English and in Spanish. So again, I'll send this out and we can share that, or you can share this with community members. And then with the numbers declining, it's just important to remember that we're not out of the woods yet. One new case of monkeypox is identified every day on average. And again, Jeff Dushin, our health officer, said that we encourage all of those who are at a higher risk to check out the different options for getting 2 doses of the vaccine, including through many healthcare providers in our community, such as the Sexual Health Clinic at Harborview. I'm going to show you some other recommendations as well. the CDC recently shared new data that unvaccinated people who were considered eligible for the vaccine. So again, that this group that we just spoke about are 14 times more likely to get monkeypox as compared to those who have not been vaccinated. So those folks who are at high risk of getting monkeypox and not getting the vaccine are 14 times more likely to get it than those who got the vaccine. So this just highlights, again, the importance of getting the vaccine. So here are a few other places where folks can go to get the monkeypox vaccine. You can contact your healthcare provider, although I will say that many folks do not have, many of the providers do not have the vaccine, although we are trying to get it into providers' hands. If you don't have a healthcare provider, highly suggest calling our public health access and outreach program. Not only can they get you connected to a provider, but they can also get you connected to health insurance and a dental clinic and ORCA cards if you're eligible, and many other, or low cost ORCA cards and many other things. They're amazing, amazing program. I mentioned that we have it at the Sexual Health Clinic at Harborview, which is on their 9th floor. And then CMAR is also providing the monkeypox vaccine, and AIDS Healthcare Foundation, or AHF, is offering the vaccinations as well to folks who are eligible, and for folks who are not insured, will get it for free. And then a couple other places, Health Point in Auburn North Clinic can get the monkeypox vaccine by appointment. Health Point Tukwila Clinic by appointment. And then again, we are continuing to work with partners and community agencies to make sure to get the vaccine out in community. And we are doing some, similar to COVID, we're doing some of those pop-ups or community vaccine events where we go to you instead of you having to come to us. And again, the vaccine is recommended 20 days apart. So you get your first shot, and then 28 days later, you would get your second shot. And it's super important, again, just like COVID, it's super important to get the second shot. And then again, if you got your first shot at one place, you don't have to go back to that same place to get your second shot. So if you got it at the Sexual Health Clinic, because that's where we had it originally, now you can go to CMAR, you can go to the Health Point in Auburn, Health Point in Tukwila, so you don't have to come back into Seattle if that's inconvenient for you. And then a reminder on how do I lower my risk of getting monkeypox. So just a reminder, limit number of partners, sexual and intimate partners, avoid going to like venues and bars and raves and clubs and bathhouses and things like that where minimal clothing is being worn, because then there can be direct skin-to-skin contact with a rash or sore if somebody has monkeypox. And then attending events where people are fully clothed is going to be much safer. Again, people can get monkeypox through kissing. So you can go to somewhere where everyone's fully clothed, but if you are kissing for a prolonged period of time with somebody who has monkeypox, you can get it that way as well. Condoms can offer partial protection because they prevent the skin-to-skin contact, especially if the sores are where the condoms are actually going to cover or come into contact with. So if there are sores on the genitals or the anus, that condom can be helpful and protect. But just that scared me. Just a reminder. Sorry, guys. Just a reminder that condoms only protect what they cover and what they come into contact with. So they're not going to cover like your face or your arms, things like that. And then also talking to partners about either about your own body or their body and new sores or rashes. And then follow up with a provider if you suspect that you have monkeypox or if you have questions. Having worked in a sexual health clinic well, having done sexual health education for over 20 years, but working in the clinics for 10 years, I know it's often much harder to actually have these conversations than it is to have sex. But super, super important to have these conversations to prevent getting monkeypox and many, many, many others. Actually, this monkeypox is not a sexually transmitted disease, but passed really easily sexually. So having the conversations can help prevent many other sexually transmitted diseases as well. And then a reminder, we talked about this last week, but the Department of Health is offering mobile services for the monkeypox vaccine clinics to go to organizations and provide monkeypox vaccines. So I wanted to put this in here again, MPV, you'll see either MPV or MPX. Those are just shorthand for monkeypox. And some people say MPV for the virus, and some people say MPX for the pox, but either way, it means monkeypox. So if you are an organization who would like to partner with a local health organization or tribal liaison to bring the mobile monkeypox vaccine to you, there'll be a live link when I send this out. All right. And then again, I'll send this out with all the different resources. Are there questions for me? I think this is like the first time that we have ended. It's 4:44. Actually, like 15 minutes. Does anybody have any questions that they would like to ask me about COVID, flu, monkeypox, clinics, anything else? All right. And then when I send this out, there's always a resource page. Feel free to share these resources in community. It has all the information about our community partner calls, and I include flyers in our multiple languages and 4 languages when I send this email out. There is also the call that Gina, who has been amazing, Gina, did you, I got an email today with, did this recently change? Are you doing them in different times now?
No, they still remain every first and third Tuesday of every month. I
Okay.
think Giselle was just trying to renew the series to last till the end of the year.
Got it. Thank you. I just want to make sure that I had the correct information in here. And then I mentioned before the Outreach and Access Program. So we have information in here about the Access and Outreach Program, both in English and in Spanish. And then lots of other great resources. All right, any questions for me? Just click through. Reminder about home vaccinations. All right. Well, I think it might be the first time we are going to be done early. A reminder to keep an eye out for the new bivalent vaccine being eligible for 5 to 11-year-olds. I'm assuming that's going to happen before our next meeting, but I don't know for sure because again, we weren't given a date. And it would be for Pfizer because anyone under 17 and younger can only get the Pfizer vaccine. Except for the vaccine. Well, that might change actually, I guess, when we get to the 6-month to 5-year-olds. All right, questions for me? Okay, well then I am going to say thank you again to Gina. I really appreciate all of your help.
Thank you.
I'm going to say thank you to all of the interpreters because I think their work is extremely difficult, especially since I sometimes talk fast. And then I did put my email in the chat earlier, but I will do so again. So please feel free to email me directly if you have any questions. Olivia, you never bother me, just so you know. I welcome questions. I will be out of the office for somewhere between 5 and 7 days, so be patient with me. All right, then I'm going to hang up our call. Thank you, everybody. Oh, can I hang up the call? Or is that? Yes, I think I can. All right, thank you, everybody, and have a wonderful day.